Hi everyone, this is Dr. Teramachi. I wanted to talk about uh, this drug called famotidine. That's the generic name, and the brand name is Pepcid. And recently, a study came out from Columbia University in New York City, and they compared two groups. One group had 84 patients who were on Pepcid or famotidine, and another group of COVID patients were around 1,500 patients, and they didn't get the Pepcid or famotidine. So when they compared both groups, they said the outcomes were better in the small group, the 84 people who got the Pepcid drug. They had a better survival from COVID. And based on that, they came to the conclusion that maybe we should give Pepcid or famotidine to these people so that they can survive COVID. So again, this is one study. You can't make a guideline out of it, but this just came out, I think, day before yesterday. I personally don't believe that Pepcid is going to help. I think it's going to harm, and this is my reasoning. And you can look at my previous video where I talk about um, stomach acid and how it is important in health and wellness. And I'll briefly discuss again about that. So stomach acid is very important for the body to digest. We eat a lot of meat, and at least this particular country, it's the most of the diet consists of meat or some type of animal protein. And when you're eating so much animal protein, if you don't have enough stomach acid, then the food doesn't get digested. When the food doesn't get digested, it's partially digested, goes into the small intestine. It tends to cause problems. Okay. Yeah, when the protein is not broken down into the building blocks, which are amino acids, then the intestine can't absorb it into the bloodstream. And also, when the complete protein is still there in the intestine, and let's say there is inflammation in the gut, then you can develop allergies or food sensitivities, and that's a whole different problem. So, um, so when there is not enough stomach acid, it leads to a lot of issues. And also when there is not enough stomach acid, you have the issue where a lot of bacteria and other things like fungi are going through the stomach and they're not getting killed. So now they go to the small intestine and the colon, and they start colonizing where they stay there, and they mess up the microbiome. And once the microbiome is messed up, you may have chronic low-grade inflammation in the gut, which can be a lifelong thing if it's not treated properly. Stomach acid also plays in a role in a lot of other things in the body. It is a very important thing. The reason why we give Pepcid or pantoprazole or omeprazole and all these acid blocking drugs in the hospital is that a lot of clients, they experience stress, not only because of being in the hospital, but also we give a lot of toxic drugs. And because of the stress, they develop increased acidity and develop stress ulcers. So that's one of the reasons why these drugs are prescribed, especially if they're in the intensive care unit. So I don't believe giving Pepcid or famotidine is a good idea for somebody who has COVID. Um, we have to wait and see what other studies show up, but that's my personal belief. Also, recently on YouTube, there was a question about Tylenol. Should you take Tylenol when you're having COVID, and what is the role of cutting down the fever? So it's a two-pronged question. For mild fever, maybe you don't need Tylenol, but the fever is too high. If it is above 102, 103, then it creates the issue. The body is getting dehydrated. Having chills. The body is breaking down muscle. So that's the problem. In that situation, probably you should get Tylenol. But if the fever is mild and you're having a mild illness overall with COVID, then I would not go with Tylenol. And here's the reason why. When you take Tylenol, what it does is it drains out the glutathione from the liver because the liver has to detox the Tylenol. Already the glutathione levels are low in people with COVID, and when the glutathione levels are low, and on top of that, you give Tylenol, their glutathione levels become undetectable, and you actually lose part of your immunity. So I don't prefer to give Tylenol if somebody has COVID. So these are some of the thoughts that I want to share today. I'm hoping you're doing well. Overall, the trend is improving in Florida. Although the cases are going up, the deaths are not as much now. The only concerning trend is in Georgia and Arizona, where the number of deaths are going up at this moment. I think Arizona, the ICU are they're either full or close to being full, so there's a lot of concern over there about COVID. These are some of the updates I want to share. I look forward to talking to you all again. I wanted to share some more thoughts over the next few days. If you have any comments, comment below. Please subscribe to my YouTube channel. And if you need to reach me privately, so you can send me a DM anytime. I'm always available to have a private conversation. Have a wonderful day. Bye.